welcome to the Sharp session today. My name is Erica Botner. I'm the program manager for seniors and the CHEP program at CHSSN. I'll be the facilitator for today's session. We also have Shannon Pearson here with us to help with any technical issues. She is labeled as CHSSN, I believe. And we are also delighted to have presenter Claire Webster here with us today, back again by popular demand. And I'll introduce Claire a little bit more formally in a couple of minutes. First, I want to acknowledge the land on which I find myself on today. Given that we are all online, we're all in unique locations with unique stories and histories. But myself, I am in Montreal, where the Guinea and Gahaga Nation is recognized as the custodians of the lands and waters. Geojahage, Montreal, is historically known as a gathering place for many First Nations, and today it's home to a diverse population of Indigenous and other peoples. We respect the continued connections with the past, present, and future in our ongoing relationship with Indigenous and other peoples within the Montreal community. So, welcome to the September Sharp information session on community resources for people living with dementia and their caregivers. As most of you know, the program has recently changed from health education sessions, they used to be called CHEP, to information sessions about resources, services, and tools available to help English-speaking seniors to age in the right place. So welcome again and enjoy the session. So I'm going to introduce you to Claire. Claire is a certified dementia care consultant and educator. She's the founder and president of Caregiver Crosswalk, a consulting firm that provides education and support services to help individuals navigate the journey of Alzheimer's disease and dementia-related illnesses. She's also the founder of McGill University's Dementia Education Program, and she recently became a member of the Government of Canada's Ministerial Advisory Board on Dementia. As a former care partner to her late mother who had Alzheimer's disease, Claire has lived experience on the impact this illness has on a person living with dementia.
I think I'd like to begin by just saying good morning to everybody. And I'm so excited to see so many of you, especially those of you that are in your local community centers. Today I'm filming from Montreal, but I'm a townshipper. I moved full-time out to Hatley. Love the Eastern Township. So who's ever out there, a big wave to all of you. So I do the work that I do as a result of my own experience as a former care partner to my late mother who passed away from Alzheimer's in 2016. I do the work that I do because I was not at all educated on this illness. I had no idea how to navigate the different resources. I really came into this kind of like blindsided, which many people do. So all the work that I do is really dedicated to my late mother. And, you know, I don't know if for those of people that have been through the assessments at the neurologist office or doctor's office, the only prescription of care that we received when my mother was diagnosed with Alzheimer's disease in September of 2006 was good luck. Okay, it was good luck. There was no information provided about what this disease was, how to access resources, absolutely nothing. And, you know, that was in 2006. And today, every time I work with families and I ask them, what information were you provided at the moment of diagnosis? Most people come up with the same words. It was either good luck, see you in 6 months, they have mild cognitive impairment, oh, it's just regular aging. So could you imagine being at a doctor's office and receiving a diagnosis of cancer or heart disease or diabetes and the doctor saying just good luck, right? Like, you can't do that. Now, unfortunately, this is something that is common not only in Quebec but on a global scale. So as Erica mentioned, I do a lot of work one-on-one with families, primarily now with Zoom, because it's just much easier to educate multiple family members. We see oftentimes that sons or daughters could be living in other provinces or other countries. So it's just Zoom has provided, like as today, to bring everybody together. And I had no prior affiliation at all with McGill University. I was extremely frustrated back in about, I guess, 2011 with our healthcare system, the fact that everybody that I was speaking to was really not getting the education and support they needed. And I said to myself, we have one of the best universities, not only in Canada, but in the world. How could I work with the university to help better educate the medical students of the future. How could we partner together? And believe it or not, they said yes. The former dean, Dr. David Eidelman, was very interested in the work that I was doing as a dementia educator. And the dementia education program was born in 2017, which I will show you later on. So I have the great pleasure, I don't know if any of you recognize these wonderful gentlemen, but I have the pleasure of working with some of the leading healthcare professionals in our province, if not our country. So at the very far left is Dr. Pedro Rosaneto, who's a neurologist. He's with the McGill University Research Center for Studies in Aging, and he specializes a lot in early onset dementia. So that's oftentimes people under the age of 65. And then we have Dr. Serge Gauthier, who is a world-renowned neurologist. These men are all the co-academic leaders of our program. And then Dr. José Moret, who is head of the Division of Geriatric Medicine from McGill University. So we collaborate together, work very closely on multiple projects. One of our great achievements is we were invited to be the lead authors of Alzheimer's Disease International's World Alzheimer's Reports for 2021 and 2022, a journey through the diagnosis of dementia, and then a whole edition focused on post-diagnostic management and care. I will show everyone afterwards how you can access it. My role as one of the co-authors of it was to make sure that when we were writing these reports that it was eligible or readable for lay people, right? So not too heavy on the medical terminology. My role was to say to the doctors, okay, we want everybody, the general public, to understand what we're writing. And we have so many testimonials in the World Reports from care partners, from persons living with dementia, all kinds of really amazing information that is intended for the general public, medical students, healthcare professionals. So I will show everyone how to access that. When we were working on the World Reports, so basically our role at McGill was to seek out what was happening literally around the world in the field of dementia. How were people being diagnosed? How were people being supported? And once upon a time, I always felt like in Quebec, we were not being educated enough, right? But what came out of the World Report is when we were doing surveys, we were surveying care partners and we were surveying persons living with dementia. The number one challenge was, again, at the moment of a diagnosis, the lack of information that was not being provided to the care partner. Okay, so this is a global problem. It's not only a Quebec problem, it is a global problem. So what is the lack of information? So for those of you in the audience that may be going through this right now with somebody or have gone through that, this is the lack of information right now that we don't have. So first of all, the majority of people do not know what the signs and symptoms of dementia are. Okay, like that is very clear. People think the word dementia means memory loss, but that's not always the case. Dementia could begin with significant changes in personality as well. So signs and symptoms, people don't really understand the importance of seeking a diagnosis, which I'm going to talk about. A lot of people say, well, why bother getting a diagnosis if there's no cure? And then the pathway, like how do we get this diagnosis? I mean, that's very confusing. In some cases, you may have a family doctor that could do the assessment, right? You could be seeing a family doctor that could do that mini mental test. Sometimes the family doctor will not have been trained in this, so they'll give you a referral to see a geriatrician. Sometimes the family doctor will give you a referral to see a neurologist. So there's no clear pathway on how to get the information we need. Another big issue for people is how do we manage those challenging behaviors, right? So when the person keeps repeating themselves, or if they're getting upset, we don't understand what's going on, how to manage these. Sometimes there are these conspiracy theories. So how do we do that? And then a big part of the illness is not recognizing all the safety issues that could happen, which I'm going to go over. There's a stage in the illness where you're thinking, is it okay for me to leave my loved one at home? That I'm just going out for a couple of hours. Is it okay? So, at what point do we know it's no longer okay? And then what are the different types of activities, especially leisure activities, that we could do to ensure that they continue to participate in life and live as high quality of life as possible, right? And then another gap is, how do I get services from the public healthcare system, right? What is the role of the CLSC? If you need to transition into a public long-term care, how do we do that? There's so many questions about how do we access those resources when we need them. And then most importantly, when you're a care partner, we don't recognize our own limitations, right? It's very easy to say, I'm good, I don't need any help. But at what point do we no longer have that ability to take care of the person properly because we're not properly taking care of ourselves? So that's a very, very common area where it takes oftentimes for ourselves to have a burnout or a crisis before we realize we need some help. Okay, so why is it important to get an early diagnosis? So we're hearing a lot of information in the news right now about new potential drugs. And again, I will encourage everyone in this audience to watch the webcast that airs today with Dr. Gauthier, and I will show you how to access it. It's because there is some hope, but only for Alzheimer's disease. So in order to know that if a person is showing the early symptoms of dementia, it's important to go and get an assessment so that the doctor could see, is it Alzheimer's? Because the new drugs on the market only work for Alzheimer's. So the other important factor is that sometimes a person could be displaying symptoms, right, that may not necessarily be dementia. It could be because there is something going on physically with the person. It could be a combination of medications that they're currently taking that could result in symptoms that seem to be like it's delirium or dementia. So if all of a sudden a person who was cognitively healthy starts acting bizarrely, it doesn't just happen overnight, okay? So it's very important to go and see a doctor. Then once there is a diagnosis, along the journey, there will be some decisions that family members will have to make. So if it gets to the point, for example, where you will have to make some legal decisions or financial decisions on behalf of the person that you are caring for, without a doctor's signature stating that that person no longer has the capacity, you will not be able to get that mandate that you need, okay? And then the other part is that along the course of the illness, it happens quite frequently that the person may start showing different types of symptoms such as depression, anxiety, aggressive behavior. And sometimes you will need to have medications that could manage those type of behaviors, okay? And the only way to do it is by also seeing a doctor. Even in the early stages of the illness, there are so many things that a person could still continue doing, okay, to embrace the best life possible. And again, it's important to have, this guided by a doctor.
No, it's not hourly.
And then as well, the other important factor is when the time comes, for example, to remove a person's driver's license or to recommend to the family that they are no longer able to manage finances, this type of information should come from the doctor. It's very difficult for family members to tell their loved one, you can no longer drive and you can no longer manage your finances. You really want to work with a doctor so that this information comes from the doctor. Okay. And hopefully, you will also have the medical doctor that could refer you to local resources in your community. So it takes a big group of people. There's a lot of team members that are involved in caring for somebody. I mean, it normally starts off with, and I always involve the most important person on this whole journey is the primary care partner, so the family member, and maybe there are multiple family members involved where there's sons, daughters, nieces, nephews, there's multiple family members. But normally it begins with the family doctor. And then sometimes, as I mentioned earlier, the family doctor may be able to really follow the person along the entire course of the illness. If they have different forms of dementia that are a bit more difficult, they may say, well, you need to consult a neurologist. It would be great if we all had a geriatrician, because the geriatrician could manage all types of issues relating to aging as a whole. A social worker plays an important role because the only way to access support from the health and from the public healthcare system is you need to have a file open with a CLSC social worker. And then if you need to transition to a long-term care, again, that is all done via the CLSC. A physical and occupational therapist, they play very important roles because if you're still living at home, you may want to have a physical and occupational therapist come and assess your home for safety to make sure that the person is at low risk of falls. So they can do a lot of things to make recommendations regarding safe-proofing your home. And along the way, there'll be a notary, a lawyer that may be needed for the mandate, psychologist is normally for the care partner to give some support, and other healthcare professionals as well. But it really takes what we call a multidisciplinary team to properly manage the patient. So what's the ripple effect on the care partner? Well, the most important part that a lot of people don't realize is that dementia causes another illness, okay? And that illness is called anosognosia, otherwise known as loss of insight. So how many of you have been caring for somebody and they are in complete denial that there's anything wrong with them, right? Like we see as family members all the changes happening, but they themselves are saying, there's nothing wrong, I'm fine. And you're seeing these things that they're saying. For instance, there could be conspiracy theories like somebody's cheating on me, somebody's stealing from me. Like in my mother's case, my parents were living in this apartment building. She was convinced that there was a whole drug lab next door. Every time the postman would come, she'd be standing at the door thinking, oh, there's the drug lab coming, or the drug dealer's coming, right? And you're trying to reason with your loved one and explain to them, this is not the case, this is not happening. But in their mind, this is happening. In their mind, this is real. In their mind, there is nothing wrong with them. So I need everybody to know that that is called anosognosia, so the loss of insight. So as much as you're going to try to argue with them and reason with them, you are not going to win, okay? So for those of you that are struggling with this, it's a real issue. Now, because of that, many people will not want to go see a doctor because they say, well, there's nothing wrong with me, I'm not going to see a doctor. So that's where it becomes a bit more challenging. In my case, my mother refused to go to the doctor. I had to literally take her against her will. I convinced her, that it was important that we all had to have an annual physical checkup, that, I was noticing changes. It was putting a lot of stress on me. Let's go to the doctor. But this is a very challenging reality for care partners to live. So just so everybody knows, you're not alone. This is a real illness. So I wanted to just show some images because, this was a good way I started showing this. I teach at McGill, the medical students, and, we talk a lot about dementia, but I rather show images so you could see the evolution. So there's 3 stages of dementia. There's the early stage, there's the mid stage, and then there's the late stage. So this was my mom in the early stages. I was an only child. My father had passed away in 2005. I had no brothers or sisters. So the caregiving aspect all fell on my shoulders. I was 38. I was working full-time in a whole other field. If anybody would have said to me one day I was going to become a dementia care expert, I would have said, like, what? But so this gives you an idea. And if you pay attention to her eyes and, physically, she still looked great, right? So one of the things with dementia is sometimes friends have a hard time believing anything's wrong with the person because they still look great. So if you see the eyes are still very clear, early stages. This is now going into the late stage, okay? So what's hard for care partners is, you're seeing this person that was once upon a time really, healthy and cognitively fine, and all the changes that are going on, right? So this is a disease that it's not only the constant loss of the cognitive changes, but you're witnessing over time the physical changes that are taking place, right? So if you see the eyes again here, you can all see how over time it really affects how they're taking in the information and the look of the eyes, okay? So what we want to worry about, to backtrack a little bit, what were some of the signs and symptoms that I was seeing at the beginning with my mom? I'll go back to this slide. Was in her case, my mother was a very physically active woman, played a lot of tennis. One year I was taking her to the Rogers Cup in Montreal, hot August day. It was like 40 degrees. And I went to pick her up and she's wearing a winter coat and high heel shoes. Okay. There was a lot of judgment going. Again, conspiracy theories. Before my father passed away in 2005, and my mother was a caregiver to my dad for most of his life. He did not have dementia, but he had other physical ailments. So she spent a lot of time lifting, transferring, and taking care of him. And so when he started saying that, she was off, I just blamed it on caregiver stress. There was a lot of responsibility on her shoulders. There was no question of anybody ever coming into the home and helping out with my father. So every time he would say she's off, I would just blame it really on him. I was actually quite angry at him. I blamed it was because of him that she was feeling this way. He would send her with a list to the grocery store. She came back with the opposite item. So if she had to buy shampoo, she would buy conditioner. If she had to buy milk, she would buy cream. Like everything was opposite with her. She started to have a couple of car accidents, and then I would just notice really becoming more and more socially withdrawn, losing her words, couldn't finish sentences. My mother was Finnish. And I didn't speak any Finnish, unfortunately, but when she started speaking to me, she kept flip-flopping into Finnish, and I would be looking at her and she was getting mad at me because she couldn't understand why I didn't understand what she was saying, but it's because I didn't speak Finnish, right? So there was all kinds of things that started happening. And then after my father passed away, really a complete inability to manage any of the finances, very confused, starting to hoard items. So she would collect blueberry and strawberry containers, hundreds of them, and just kept saying, like, I don't feel like cooking. I don't feel like doing this. I don't feel like doing that. So it was really changes in her behavior, which, started making me think, okay, this is not normal. And it took about, I would say, a year and a half before I decided to finally have her properly assessed, because I kept blaming it on, after my father died, that she was maybe depressed. There was always these excuses, right? But I wasn't aware of all the signs and symptoms of dementia. So safety is something that we really need to take into consideration. There's every room in the house that could be a possible hazard. And, a lot of people that I work with ask me, is it okay if they stay home alone? And, I work with the family care partners. I don't always see the actual patient, but I think all of you know inside when it gets to the point where maybe it's not so safe, right? It's those little accidents. Maybe the time that they forgot to turn off the stove. Maybe they went out for a walk that just was too long. Maybe that little trip, like they start tripping on the stairs, right? Because dementia doesn't only affect our thinking, okay? Dementia really affects a person's mobility. So many of you may start to notice that the person is starting to shuffle. They're not lifting their feet as much anymore, right? So it becomes very easy to trip. Dementia also affects our vision. So when you're healthy, you have a very good peripheral vision. We can, see a good scale. But as the disease progresses, the vision becomes narrower and narrower and narrower, which makes falls even more frequent. So is there a risk that when the person wakes up at night, that perhaps they could trip over something outside the bed? Do you have night lights in the hallway? Do you have night lights in the bathroom, right? How is their mobility when they get to stairs? Are you noticing a change or a hesitation when they are approaching stairs, for example? Is there a risk of them missing the last step? Okay. Are there cords or loose carpeting around where they can fall? So we really want to try to avoid any injuries. The kitchen, for example, we would teach at McGill at the Steinberg Center, where a person could take, for example, an aluminum bowl and put it into a microwave. And you're not supposed to put an aluminum bowl, right? Or those gold-plated plates. Or by accident, instead of putting 30 seconds to heat up something, you press 3 minutes. Do they forget to use oven mitts when you take out something from the oven? We see also leaving cleaning products around on the kitchen counters and then mistaking a bottle of Lysol for olive oil, right? And a lot of the hazards also happen in the bathroom, like even healthy individuals. Do you have a bath mat outside of the bathtub? Right? Is there any risk of you falling? If a person who has dementia, they should not be taking their medications on their own anymore, right? Because they could be forgetting that they already took their pills. And a lot of care partners are frustrated because they're telling their loved one, you keep forgetting to take your pills. Well, that's normal. As the disease progresses, they need prompting, okay? They really need prompting with all of their activities. They need help to get dressed. They need little reminders. They need help to turn on the shower. They just need constant reminders. All of their abilities for activities of daily living will disappear over time. So when we talk about safety, it's not only home and physical safety, we're talking about safety managing finances. One of the clues about dementia happens oftentimes a couple of years before a person is even diagnosed. You know, people could start investing in sort of transferring their finances to things that they would have never done before, making mistakes, giving to charities that they had never given to before. It's very easy today to become scammed. You know, there's so many types of email frauds and telephone scams. And, so it's that whole loss of insight, that extra sense that, we have when we're healthy and we think, maybe this is not UPS calling, maybe this is not Amazon, maybe, when that Canada Revenue Agency calls and you go, oh no, this is a scam, right? So there's so many ways to get frauded. Also, the problem with somebody who is diagnosed and is still controlling their credit card or their debit card, they can go to the bank, withdraw cash, forget that they withdraw cash, go back. And oftentimes we see people who are hiding the money in the house, or they could even be giving it out to people that they shouldn't be giving it out to, right? So financial safety is something that's very important to take into consideration. The big aspect of driving, well, how does dementia affect a person's driving? So it's the reflexes. So when I was talking about the peripheral vision, we have to be so aware, especially now with all the crosswalks, it's the change of like all this construction, the detours. Yes, there are people that still have dementia and drive because the family will say, well, they know the routine, they know they were back, but what happens if there's a detour, right? That will confuse them. As the disease progresses, a person will have a much more difficult time recognizing red light, yellow light to slow down, green light, right? Looking both ways, the difference between the gas pedal and the brake. So, there's so many things that can go wrong. Again, when it comes time to make the decision to stop driving, that really should be in the hands of the doctor. Now, wandering, this is the big issue. We hear every single week in the news that if somebody has gone missing, right? We see a person has gone missing from their home. Because dementia affects also sleep patterns, it's a disease. It is, if there are no existing health conditions, for example, a person could have dementia, but could also have heart disease, cancer, but dementia on itself is a terminal illness, okay? As the disease progresses, people start to sleep more, the sleep patterns change. Then they may start waking up at 3, 4 o'clock in the morning thinking it's time to start the day, right? And so what do? They can just wander outside. There are some people who think that they're still working, even though if they haven't had a job in 10 years, they may wake up suddenly and think, oh, I'm going back to my office, right? So how safe is your house? Like if you're living with somebody and, for example, as a caregiver, you may be very tired. If somebody wakes up in the middle of the night, are there chimes on the door alerting you that the door is open, right? Do you alarm your house at night, right? What are the risks of a person leaving? So it's important to think about, or the other thing that we see often is a person gets up in the middle of the night and it could fall downstairs, right? And so the way the disease progresses, it will progress if somebody suffers a physical trauma as well. So wandering is a big issue. Is fear of water a characteristic of dementia and Alzheimer's? Absolutely. For whatever reason, it becomes much more difficult for people to want to take a shower. We don't exactly know why, but it's that feeling of the water, especially in a person's head, that feeling of vulnerability. Showering becomes much more difficult. So what we recommend over time is perhaps bringing a chair into the bath, into the bathtub or shower area, sitting down, using a handheld shower, and just maybe covering up body parts to not expose everything at once, okay? Because it's that feeling of just being vulnerable, and we don't know why, but it becomes, and that's one of the reasons why people who have dementia over time, they stop showering, and they're also just afraid. And so it's to change the way we're doing that, right? So sitting down, handheld, one at a time, maybe put a robe or covering up with a towel certain body parts, and just gently taking your time doing that, because it's a very, we don't know why why that happens. So when do we know that it's time to make a change? You know, one of the big challenges for care partners and families is to say, okay, I can no longer really do this on my own, or the time has come that I just can't, I can't take care of the person at home anymore, right? There's a lot of barriers. And it normally happens when, as the disease progresses, it turns more from the cognitive changes to the physical changes. When you see that, you know, you need to constantly assist the person with dressing, with feeding, with bathing. They're having a lot of incontinent issues. It's just becoming much too tiring, right? And then you realize I either need to implement much more home care support, or it's time to maybe transition to a residence. What prevents people? It's the guilt, right? We think, oh no, I made a promise to my husband, my wife, my mother, father that, you know, they would live at home for as long as possible. Guilt prevents people from making changes. Unfortunately, guilt could also get in the way of you providing the best quality of care. It just may not be possible. There's also the lack of knowledge. Like, let's say the time comes where you do need to make a transition to long-term care or to a residence. What's the difference between private residences and the public system, right? So the public healthcare system right now, there's about a 2-year waiting list, depending where you live. Maybe in the Eastern Townships, it's not as long, but in Montreal, it's a good 2-year waiting list. The only way to access the public healthcare system is you need to have a file open with the CLSC, and you can't decide at the last minute that this needs to be done now, right? Private residences, in general, there are no waiting lists, maybe a month or two. There's a significant cost, anywhere from $7,000 to $10,000 a month, depending on the level of care that a person needs, right? And you really have to do your research. Not all of these private residences that are offering, that are offering assisted living could provide proper memory care, right? And then, the other part is that, as I mentioned earlier, sometimes we don't recognize our own limitations. Like when do we recognize the fact that we can just no longer take care of this person? A lot of times it's an aging senior caring for an aging senior. So if you're somebody who's in your 80s and, just physically and mentally, it just may have become too much, because you also don't want to risk your own injury, right? If you're at that point where you're caring for somebody at home and you have to lift them and get them off the toilet seat or help them get into the shower, are you at risk for hurting yourself, right? So it's important to assess that. The other part, the reality that I see too frequently, is that this disease does cause a lot of conflict among family members, right? So there may be a son or daughter that doesn't agree that it's time for mom and dad to move, or that they may not agree that we should spend the money on having people come into the home. So it causes so much conflict among family members, and it's very important that you try as much as possible to all communicate together, share the information, and share the responsibilities. Sometimes it's often the daughter. There's one daughter that's doing everything because her siblings may be living out of province, right? But just because they're living out of province doesn't mean that they can't participate in helping out. Somebody could be helping manage finances. Maybe somebody could help manage medical appointments. Maybe somebody could help manage the property or something. But conflict arises when one family member feels like they're doing everything and nobody else is helping out. And unfortunately, dementia is one of the most expensive diseases to manage financially. It is, because you will probably never get enough support from the public healthcare system. You will inevitably have to hire some private help at home to complement the hours that you may or may not be receiving from the CLSC or other not-for-profit community organizations. Again, if you have to suddenly transfer to a private residence while waiting to go into the public, it puts a lot of financial stress on individuals. So the other issue is, again, recognizing our own boundaries. And I was very, very good at this, right? I thought that I could manage everything. I could manage my 3 young children, my former career, my husband, his family, I could do it all, right? And some of my friends were witnessing me starting to like burn out. And what was my go-to answer? I was always like, no, many thanks. I'm all good, right? If they would offer to pick up the kids at school, if they would offer to help, my first words out of my mouth were, no, I'm all good. Thanks. I'm not there yet, right? So how many of you are saying that too? Like, I'm good. We're not there yet. We're just not there yet. Unfortunately, we will be there. And, there's a lot of emotions that we go through. And the one emotion that many people just don't want to talk about or admit to is anger. Okay. And anger is one of the most common emotions that we face when we're caring for somebody. And it doesn't only have to be for dementia. You may be a caregiver for somebody that's, suffering from another illness. So what causes anger? First of all, when you receive this news, this incredible shock of a certain diagnosis that is going to permanently interrupt your life, right? So it's like, how could this have happened to my husband, my wife, my mother, my father, right? And then it's like, how could this have happened to me? Because this is a disease that affects everyone, right? There's a ripple effect. And, for those people that are probably planning your retirement years, people who get dementia are normally over the age of 75. And it's like, okay, all of a sudden you reach a point in your life where it's time for you, right? You're at that stage of your life where you want to travel, you want to enjoy the grandkids, you want to go spend a few months somewhere else. And then all of a sudden those plans are interrupted. And then a lot of us say, well, I just, when you're not truly educated about the illness, when you don't understand something, it's like, how could you deal with it? But what I hear most common from care partners is, I just don't have the patience and energy to deal with this anymore. I don't have the patience. I just can't. I often hear the words, I feel like I'm a prisoner right now. I just don't have the patience, right? What about my life? Like, I just can't do this. And again, the finances put a lot of pressure on people. So how can this afford it? How can we afford it? And then a lot of times I also see families where they don't like their mother or father. They don't like their husband or wife. And all of a sudden they're like, how am I going to spend the next 10 years, for example, taking care of this person that I don't like, right? So these are the different issues that come up. So if any of you are feeling this way, I just need you to know that you're not alone. In addition to that, there are other emotions that come into play. So there's the denial. So a lot of times early on, you don't want to believe that this is really happening. You're seeing changes, but you don't want to believe it, right? So you stay in a state of denial. The longer you stay in a state of denial, you're preventing yourself and you're preventing the person from getting the attention that they need, right? That early diagnosis, for example. We talked about the guilt, the grief. You're constantly in a sense of loss because it's a disease, because it lasts over several years. You're losing different parts of the person over time. So at the beginning, it's for spouses especially, they talk about the loss of communication, right? To be able to sit down and have a meal together, and that loss of not having those conversations anymore. There could be the loss of the intimacy. There's the loss of witnessing how much the person can no longer do as a couple, right? So you used to play golf together or play bridge together or travel together, right? So you're missing that companionship. And then it causes a lot of isolation. So there's a big stigma, unfortunately, around this illness still, where, people nobody wants you to say anything. So for example, my mother would say to me, don't ever say the word Alzheimer's. Don't tell anybody, right? We have to hide it. So especially for couples, sometimes you may find that you're no longer hanging out with your friends because you're embarrassed about how your spouse is behaving. And that's wrong, okay? That's really wrong. So I encourage people today, if your loved one has just been diagnosed, please, as much as possible, share this information with your close friends. Allow them to be there to support you. Don't become isolated. And yes, the disease at times could cause a person to say, things that may be inappropriate. That's just part of what happens. The person starts using words and saying things that are not necessarily appropriate. But that even more so a reason to let your friends know that, your loved one has this illness, right? Because oftentimes if you don't say anything, they may think, oh, maybe the person has a drinking problem. Maybe something else is up, right? So you need to be with your close friends. Anger comes into play, as I mentioned earlier. And then everybody has a coping mechanism, okay? That could be drinking too much. It could be smoking. It could be taking Ativan. It could be eating too much, shopping too much. but most people, almost everyone, has a way of coping with their stress. And then most of the time, the way we cope ends up leading to shame. So in my case, I would drink a copious amount of wine. I would not even remember putting my kids to sleep, wake up the next day feeling hungover and shame because when I was drinking, it would even make my anger even worse, right? And then I would swear the next day that I would never do this again. And then the cycle would just begin, right? So shame is something that often happens because of the way that we cope. And, you have to be careful for this because I often see, like even in my case, where certain coping mechanisms that you use can turn into addictions, right? And people sometimes say, well, once the caregiving role ends, I'll be fine. It doesn't work like that, right? So if you're using a coping mechanism over many, many years, it doesn't just disappear once the caregiving role changes, okay? So what our goal as caregivers, I always look at it as we have three basic expectations, okay, or objectives. So my role was I wanted to keep my mother as happy as possible for whatever that word meant. I wanted to keep her safe and I wanted to make sure she's clean because that is what I looked at as in terms of really preserving a person's dignity. So everything that I would do in advocating for her had to correspond to those three objectives. So how do we get there? So acceptance is really the first step. As I mentioned before, it's if you don't accept what you're facing, you're not going to get to the next stage. Okay. If you're going to stay in a state of denial, if you're going to delay that first doctor's appointment, if you're going to delay implementing some of the suggestions that they've made, you are really preventing that person from getting the best quality of care possible. And you're also preventing yourself from getting the care, the support that you need. Knowledge, I'm going to take you through our website shortly, and I'm going to show you how you can become as educated as possible. For whatever illness you're dealing with, it's important that you become educated, okay? So whether it be cancer, whether it be heart issues, whether it be dementia, diabetes, understand the illness, okay? Knowledge is the most powerful resource. We can't expect the healthcare professionals to educate us, right? That we get 10 or 15 minutes in their office. It's up to us to educate ourselves. So not only about the illness, but become educated about all of the resources that are available to you in your community. There's a lot of amazing community, not-for-profit community resources. And you may also have to become educated on the for-profit resources that are there, right? Because again, the home care, the healthcare system can only provide so many hours a week of home care support. So you may in fact need to go to a private agency at some point. Do your research, understand, do they have staff that are trained, right? Same thing if you have to make the decision to transition to the public long-term care or a private, do your research, right? Do they have staff that are trained? Like what are their safety measures, right? So knowledge is really very powerful. If you haven't gone yet to get your first assessment, okay, and you are about to go, please make sure when you arrive at the doctor's office that you are prepared. We make the mistake sometimes of arriving there thinking that the doctor is going to see us and know everything about us without us providing any information. It doesn't work like that, okay? So I brought my mother when we had to go see the neurologist. I had none of this prepared, thinking, well, he's gonna be able to respond to all that. How could he make an assessment without me giving him the information? So when you go to any doctor's appointment for anything, arrive prepared, because these are the questions they're going to ask you. What is your medical history or the medical history of the person? Bring the list of all medications, including supplements, okay, if they're taking vitamins or any other, non-pharmacological products, so bring the list. Do they wear a hearing aid? Do they wear visual aids? Do they have physical aids? Okay. And write down your concerns. Okay. And when you're dealing with a person with dementia, if possible, if you could send your list of concerns to the doctor prior to the appointment, because it's very uncomfortable when that patient has that anosognosia, meaning they don't want to be there. You sitting with them, telling the doctor all of these symptoms, and they're sitting there saying, what are you talking about? That's not true, okay? So if possible, send the list of symptoms prior to the appointment, right? And then ask the doctor for the next step. So depending on where they are, should they still be driving? Is it okay for them to still manage their finances? Do you think that they are okay still living at home alone, okay? And then ask them, are there resources in my municipality that could help me? Right? But be prepared. Don't ever go to a doctor's appointment for anything really without having this list, because when you're there, we're all a little bit nervous, we're feeling pressed for time. And the average time that we have with a doctor is not normally more than 10-15 minutes, okay? A proper assessment of dementia should take about an hour, okay, to do a proper assessment. But we don't necessarily get that from depending where we live and who we see. And, having these conversations about the future are very important. Like, these are conversations we don't want to have. I mean, I never asked my parents about their wills, about their mandate, about, in the event that they were no longer able to, take care of themselves, what they want. But unfortunately, because this is a disease that is ever evolving, it's important to understand people's wishes, right? And also, if you are caring for somebody with dementia, you will have to deal with your mandate, right? You will not be able to cancel their utilities. You'll not be able to make decisions on their behalf if you don't have a homologated mandate. So make sure that you speak to your notary or your lawyer and you have all your papers informed. And, COVID taught us that in life, we have a plan A, but we always need a plan B. So when I work with families, they say to me, well, I promised my husband, my wife, my mother, my father, we would never transition them to long-term care. That's fine, but what happens if something happens to the primary caregiver? So for example, if right now you're a couple and one of you passes away before the person with dementia does, what's going to happen? Will the person with dementia go and live with your grown-up children? Will the grown-up children go and live with the person? In life, you have to have plan A and plan B. Okay. And try to be one step ahead at all times. So just do your research again. In the event that something happens to me and I can no longer care for this person, what are my options, right? And do the research now. Don't wait for crisis to happen to get to this point. And then, important to understand in your local communities, how do you navigate the CLSC? So what is the role? What could they offer you? Okay. What, again, like it's important to, if you, depending on the stage of the person, don't wait until you think, okay, they're really getting to the late stage and now I'm going to call the CLSC and then now they're going to help me. It doesn't work like that. In many municipalities, it may take up to 6 months to get an appointment to have a social worker come and do an assessment. And then once they do the assessment, it could take many months afterwards until you get the support that you need. And a lot of families say to me, okay, well, they still haven't called me. I'm waiting for them to call me. They have hundreds of cases, right? It's up to you to be proactive. It's up to you to make those follow-up phone calls with them, okay? So please make sure you're the one that's following up and following up. Don't sit by the phone and wait for that phone call because you're going to be waiting for a long time because there are so many cases right now. And, finally, as the disease progresses as well, your role is to really be the advocate. So as the disease progresses and the person that you're caring for can no longer be their own voice, it's your responsibility to become their voice, right? So to ensure that they're safe, to ensure that they're clean, to work with the CLSC. It could happen where they're already in a residence and it's no longer, they're not getting the care they need. So it may be your role to say, okay, this is not working. We need to do a switch to another residence, right? But it becomes a very important role. And, for sure the disease presents with some very challenging behaviors. And it gets to a point where the person loses their ability to communicate that you may not be able to understand, like, why are they behaving the way they're behaving? I would say in the very beginning, it's important that you understand the person's life story. Who are they? What are their likes? What are their dislikes, right? Because when it gets to the stage where they can no longer express themselves and they're having a bad day, what could be bothering them, right? It could be something physical, like maybe they have stomach ache or they're constipated or they've hurt themselves and they can't tell you that something's wrong, right? So you have to kind of like be a detective and investigate. Maybe they don't like peas and carrots and that's why they're not eating, right? Who is this person? Like really try to understand what are their likes? What are their dislikes? What are some of the triggers now that could get them upset? What are some of what are their happy emotions, right? And if you are living at home with somebody, it's also important to pick your battles. So I see a lot with couples where, yes, as the disease is evolving, the person starts maybe wandering around the house and changing their clothes multiple times a day and just going into the cupboards. If what they are doing is not hurting themselves or anybody else, let them be. Sometimes we spend too much time nitpicking the person, saying, why are you doing that? Why are you saying that? Don't you remember? Like, why, right? And that could cause an argument. So really think about if what they are doing and what they are saying is not harming anybody, let them be. And you want to join their journey. So sometimes they start telling stories about the past where, you're sitting there and saying, it's never happened like that. Who cares? Okay, let them talk, because in their mind, it happened that way. So again, if what they're saying isn't hurting anybody, just let them be, right? And how much of it, like, make sure that you have enough breaks. So maybe you're frustrated, maybe, and what happens is with people with dementia, they will always feel your energy. Maybe you're feeling frustrated. Maybe you haven't had enough of a break, right? So, it's important to really just take some time for yourself. And the other reality is a lot of families they have a hard time of letting go who the person was and really adapting to who they're becoming. So for example, I'll have people say, well, they used to love to cook, or they used to love to play golf, or they used to love to do this, and they're not doing this anymore. Well, of course they're not doing this anymore because they have an illness that is changing them, okay? So please, you have to stop living in the past and start to really allow yourselves to evolve to who they're becoming, and really embrace everything they still can do, right? So if they really love to still go on walks, or if they like to still play tennis or golf, it may be different. They may not be playing the way they used to, but really this is a moment, especially as it gets into the middle stage, embrace everything they still can do. And then finally, it's about using the compassionate lie. So sometimes, we feel that we need to tell the person the truth all the time. But if the truth has a potential of causing a catastrophic reaction with them, why do that, right? Why would you tell somebody something that could have the possibility of really upsetting them, and the next day they're not even going to remember what you told them, okay? So it's okay at times to use the compassionate lie. And then most importantly, along the journey, it's about taking care of yourselves, right? And I suffered a very severe burnout in July of 2011, which is common for care partners. It wasn't only because of caring for my mother, it was life circumstances that all added up and got together and just created a big bang. And it was a very significant burnout. And on my road to recovery, I really had to do a triage of my life and say to myself, what's working and what's not working anymore? Who are the people in my life that are taking up too much of my energy? Maybe I'm overcommitted in projects or too many volunteer committees. Or every time I got that email or that request, I'd be like, oh God, I don't feel like it, right? So I knew that I really had to let go because I was only halfway through the journey with my mother. And I had to just say to myself, if there are certain people in my life that I can't be around anymore. I mean, with family members, it's difficult. So I would start to say, I put boundaries in where I would say, okay, certain people, it's only lunch, no dinner, because lunch is an hour and a half. Dinner, it's too long, it's 4 hours, and sometimes it involves alcohol. No, right? But I had to put boundaries in place. And even there were certain people, friends that were calling and saying, we never hear from you anymore. What drama is going on in your life? Those people, gone. And my mother passed away in 2016, and I still live my life really trying to focus on the people that I want to spend my time with and the projects that I want to commit my time to. So even there are many times people reach out to me to go for dinners and stuff, and I say to myself, do I really want to spend 4 hours of my evening with these people? What type of conversations? Will they add value to me, or will they not add value, right? How will this project help me? So I'm very selfish with my time. I'm very selfish with the projects I align myself, and we always apologize for saying no, but you have to be able to say no without apologizing, right? So if you're on this journey, you are the most important. If you can't take care of yourself, you're not going to be able to take care of anybody else. Okay. So please make sure that you make yourself a priority. So the other, before I go into and show you our website, so everybody is now asking about how do we prevent it, right? It's a disease that everybody is fearing. Unfortunately, it's close to 1 out of 5 people that are getting diagnosed with dementia. So here are the things that you can do. Okay. So physical activity, stay as active as possible, right? Walk, do light workouts, but whatever physical activity you can do, like we said earlier, what's good for the heart is good for the brain. Try to keep as physically active as possible. Stop smoking, okay? Manage your alcohol consumption. There's all kinds of different thoughts on the alcohol now, from drinking 2 glasses to no glasses, moderate alcohol consumption. For those people living in the townships, well, you don't have to worry about air pollution. So, but there are seeing the correlation between air pollution and dementia. Stay as socially active as possible. So what you're doing today, those of you gathering in community centers, stay active, get together with your friends, talk, do not isolate yourself, okay? If you are having hearing problems, please go and see for hearing aids. It's extremely important to manage your hearing. There is a correlation between head injury, so concussions, and dementia. So, that they know that for a fact. I mean, the more head injuries a person has, the more risk you are for developing dementia. So all pre-existing health conditions. So if you have high blood pressure, high cholesterol, anything like that, take your medications. Do not take your pills, okay? A lot of people are like, oh, I don't want to take these high cholesterol pills. I don't want to take my blood pressure medication. Make sure that you take your medication and manage all of those, okay? So for example, I have high cholesterol from I've inherited that from my mother. It's genetic. I was put on Lipitor at the age of 50. It's kind of like, I didn't want to take this, but I know that I must manage all of my existing health conditions, right? Diabetes, manage your diabetes. If you are suffering from depression, please try to manage also your depression, manage your weight. And they put this thing about, less education, but I have, like the more educated you are, the less risk you are for dementia. But I have to be honest to say that a lot of the families that I work with, I mean, dementia doesn't discriminate. My clients are doctors, lawyers, politicians, you name it, right? So I'm not too convinced about the less education piece, because it really doesn't discriminate. Now I'm going to take you to our website. This is the McGill website. So it's mcgill.ca/dementia. Okay, so one of the most important resources that we developed, and I believe that this guide has been distributed throughout many of your community centers, is the Dementia Companion Guide, okay? You can download this for free as well. So on our website, I'm going to go back here. So when you go on our website, and I know that I can appreciate there may be people that are not so computer literate, but it is pretty easy to navigate. So the Dementia Companion Guide is a book that was developed by myself, Dr. Moret, Dr. Serge Gauthier, McGill School of Physical and Occupational Therapy, McGill School of Social Work, and we even have things from the Alzheimer's Society of Canada. You can access it for free here by just clicking on one of these buttons. It's in 10 different languages and many more to come. So it's currently available in English, French, Spanish, Portuguese, Mandarin, Italian, Greek, Russian, Ukrainian, Punjabi, and Greek. And again, many more versions are to come. And it was thanks to, so our program is 100% dependent on private donations. And so we got a great donation from the Grace Dart Foundation to be able to develop this book. Please, this is an incredible guide that's available to you to really learn all about dementia from A to Z. It's got some beautiful images, and please go and have a look. The other important resource is the McGill Cares webcast series. So I've produced about close to 100. I'll get to my 100th episode in November. And you could access it on demand anytime. So you go to McGill Cares, and then you just click on this button that says the archives. This is an image of my mother and I, which they had done for me. And you just select your topic. So it's all listed here by the title. And then sometimes I've interviewed caregivers. Dr. Gauthier's talk has spoken about understanding dementia. There are so many different subjects that you could just sit, and they're all accessible on YouTube. Okay, so all you do is you click, and then you click on the YouTube link, and then enjoy. Okay, and I have people from all other leading experts from even outside the university. Teepa Snow, who's become quite famous, who's in the US. She's taking care of helping Bruce Willis's family. She's on here. So please take your time and really go and have a look at all these webcasts. So the other very great resource we have for you is called the Dementia Activity Booklet. And there are over 40 different types of leisure and recreational activities that you can do at home with your loved one. So in this book, it's available in English and French. You click on it and you may have to put in your email address just because we're trying to track how many people are actually downloading it. But there's all types of activities: scrapbooking, beading, cooking, all kinds of gardening, all kinds of activities that you can do, especially as the winter months approach, all kinds of things that you can do. And we are very excited because over the coming months, we are making these activities come alive. So we are converting this activity book into little mini video capsules showing people exactly what to do, and they will be available for free as well. And that's just coming up over the coming months. So stay tuned. And the best way to really stay in touch with us is I really would recommend that everybody subscribe to our newsletter. There should be a little pop-up that will come up when you go on our website, and it just says subscribe to our newsletter. We could also give with Erica, if people just send an email to dementia@mcgill.ca, please join our newsletter, because then you'll always be updated about all of our upcoming great resources. So we also have support groups, virtual support groups in partnership with the Alzheimer's Society of Montreal. We offer support groups for spouses or children, like adult children that are caring for a family member with dementia. You are all welcome also to try to register for the support groups. Again, it's virtual. We may have waiting lists, but if you get on the waiting list, depending on the group, it's really great. We've just started a new one for what we call young caregivers. So these could be for adult, like university students or anyone who's caring for a person who has dementia, basically under the age of 65. So sometimes you have teenagers caring for parents or younger spouses caring for younger spouses who have the illness. And then we have another one called Caring Conversations. This is hosted by Lucy Barilak and Joanne Besner, who are two pioneer social workers from Quebec who've been in the field for many, many years. Every month they have a different topic. And again, if you're subscribed to our newsletter, you will get all this information, how to register. But this is a webinar where you register for, and it's interactive with them on all kinds of different topics, okay? And then finally, we have a whole section on additional resources. So I'm going to go over here to dementia resources. We have a whole history of past public lectures that I've done for other organizations. We are developing a free online education course, so that it's going to be 10 modules, hopefully to be released in January or February 2024, where you can go and take an online education course, 10 modules on exactly how to care for the person living with dementia. This is all for free. The World Alzheimer's reports that I was referring to before, you can access them here too, and you could download them, read them. There's some really interesting information that's available for you there as well. And then under trusted resources, we also have a great program. It's called the Safe Senior Adult and Exercise Program, developed by Dr. José Moret's team at the Montreal General Hospital. And here it really has all kinds of exercise programs that you can do for free at home. So it's an excellent program. It's how to keep yourself in shape, even chair exercises, anything to fit different types of levels of activities. Again, all for free on our website. So please, I encourage you all to, I'm going to stop sharing the screen here. I encourage you all to go and visit the McGill website. Take your time. It's pretty easy to navigate, and absolutely everything is available for you there for free. Well, I really hope everyone found this useful and educative. There's so much information, and that's why we produce the Dementia Companion Guide that I really encourage people to read.
I think we've learned a lot. you know, about dementia, and also about the resources available at McGill and support for caregivers. So I want to thank everyone for their engagement in today's session. And on this topic, hopefully you'll share with someone what you learned here today, maybe tell someone else about the McGill website. That would be great. And thank you once again also to the SHARP coordinators, or the Sharpies, and to Shannon for the technical support. And on behalf of all of us, a huge thank you to Claire for your excellent presentation and shared insights about community resources for people living with dementia and their care partners.
Thank you, everyone. Thank you for coming. Thank you.
Thank you very much.
Thank you so much. Great.
Thank you very much.